I'm very happy to be with you today, together with such inspiring academics, professional, experts, practitioners. So, to introduce this session on the relationship between freedom of conscience and freedom of healthcare institutions regarding controversial practices in healthcare, I would like to address the issue of freedom of institutions in its relationship with state neutrality, more specifically state neutrality as an argument for or against freedom of institutions. Let us first take several concrete examples here to illustrate what is precisely at stake when we talk about freedom of conscience, freedom of institutions in bioethics. The comment doesn't work. Okay. So as first example, I would like to mention the case of the Irene Thomas Hospice in British Columbia, so in Canada. As a hospice, this healthcare institution focused its end-of-life care project on palliative care, meaning that residents are accompanied and cared for until the end of their lives. And when euthanasia was legalized in Canada in 2015, 2016, the Delta Hospice Society, so the society which managed the hospice, this society considered that euthanasia was not compatible with the ethics of the institution and that it could not be practiced within the hospice. And it's important to mention that a hospital located a few meters away from the hospice agreed to practice euthanasia, so there was no question of lack of access to euthanasia in that case. And nevertheless, in 2019, the British Columbia Health Authority considered this palliative care approach that excludes euthanasia as illegal and stopped the public funding of the hospice and eventually forced the Delta Hospice Society to vacate the hospice. So in this first illustration, we could also mention the Belgian law on euthanasia, which was amended in 2020. And one of the amendments bans clauses that prevent doctors from performing euthanasia in a healthcare institution. A second illustration of this relationship between freedom of conscience and freedom of institutions can be found in the Déclaration gouvernementale, so the political program of Communauté Française de Belgique, so it's one of the federal entities of Belgium. And among various measures that were announced by the government, the declaration refers to the government's plans to, I quote, introduce abortion techniques in the mandatory courses of students in faculties of medicine, end quote. So on this matter, we can also mention the exact same project as the French-speaking community project. So the project of the Spanish government in 2010, which at the time led to protests from several universities, from hospitals as well. Because they considered that academic freedom, freedom of association were at stake, as well as the freedom of conscience of professors or students. And one third and last example on this relationship between freedom of institutions and individual freedom of conscience concerns the Belgian law on assisted reproductive technology, so ART, voted in 2007, and Article 5 of this law mentions that, I quote, reproduction clinics shall be free to invoke the conscience clause in relation to requests made to them, end quote. So each of these three examples show us how crucial, how concrete this issue of institutional freedom can be when we talk about controversial practices in healthcare. So to address this issue, I will start my presentation with a few remarks that are a theoretical background regarding the legal recognition of institutional freedom in human rights law. My second point will focus on identify two opposite ways of articulating the link between state neutrality on the one hand and freedom of healthcare institutions on the other. And in this second point, we will see that state neutrality actually regularly appears most of the time implicitly as an argument for or against the recognition of the freedom of healthcare institutions with respect to controversial practices. And I will then conclude with a few open-ended remarks for further discussion. But my third point will be about counter-arguments to this notion of freedom of healthcare institutions. So first point, the theoretical background regarding freedom of healthcare institutions. So let us address what human rights law has to tell us about this question. One first clarification should be made regarding the question of conscience. As organizations, healthcare institutions are legal persons and not natural persons. And contrary to these natural persons, legal persons do not have a conscience, and therefore they cannot invoke freedom of conscience as such. But of course, the question is whether the absence of a conscience means that a hospital, a university, has no right to claim respect for certain values or ethics that are associated to a belief or a philosophy, especially when these values or ethics are at the very heart of their social purpose. So at this stage, we could offer a clear and quick answer to this question by referring to the Belgian law on assisted reproductive technology, which I just mentioned in my introduction, and which refers to the so-called conscience of reproduction centers. So, of course, this provision is poorly formulated because, as we saw, companies have no conscience as such. But the reference to this idea of conscience with respect to healthcare institutions shows that the Belgian legislator acknowledges that there is a need to recognize and to protect the freedom of healthcare institutions from an ethical point of view and from a legal point of view as well. And from a legal point of view, precisely, this freedom of institutions to act according to their beliefs or values is supported by two different fundamental rights and freedoms. And the combination of these two fundamental rights, which I will present immediately, this combination can be summarized in the idea of right to autonomy or institutional freedom, which is recognized for certain organizations, in particular healthcare or educational organizations. So the first of these two fundamental rights is the freedom of association, which is guaranteed by Article 11 of the European Convention on Human Rights, and which protects the right of individuals to associate around shared values, around beliefs, and to create, manage, and maintain organizations that reflect those values. The second fundamental right, which supports the argument of a right to autonomy for these institutions, is the freedom of thought, conscience, and religion. So Article 9 of the ECHR. Article 9, which explicitly includes a collective dimension in this right. And the European Convention, the European Court of Human Rights regularly recalls in its case law that a purely individualistic approach regarding freedom of religion or belief would make this fundamental right largely theoretical or ineffective. So the collective enjoyment of freedom of religion is necessary to allow individuals to be supported in their daily lives by educational, cultural, and healthcare institutions which welcome and which embody their personal beliefs. And this necessity of institutional freedom is also confirmed by the EU, by other legal orders which recognize the concept of ethos-based organizations. These ethos-based organizations are public or private organizations whose ethics are based on religion or belief and that can demand a higher degree of loyalty from their employees with respect to the organization's ethos. And lastly, we could also mention a third fundamental right in support of freedom of institutions, which is the right to freedom of expression, enshrined in Article 10 of the European Convention on Human Rights, and which is also recognized for organizations to a certain extent. So in more practical terms, regarding healthcare institutions such as hospitals, such as nursing homes, or fertility clinics, the recognition of institutional freedom to these organizations will allow healthcare professionals, but also patients or residents or even volunteers to work, to live, to be involved in these organizations in a way that it is compatible with their beliefs, or in other words, without having to put their conscience on hold while they are living or working in these organizations. Of course, freedom of association, freedom of belief, of conscience, freedom of expression are not absolute fundamental rights. Neither is institutional freedom. These freedoms must be balanced against other rights, or other fundamental rights and interests, such as the rights of the patient, such as public health. And the key question here is, as we discussed earlier, especially this morning, the key question is to define what is public health, of course, what is not, but also what is a patient's right and what is not. So this theoretical background now leads us to our second point, which relates to the relationship between the notion of state neutrality and the freedom of healthcare institutions. And the choice I make to focus on the concept of neutrality might be surprising, as neutrality is not systematically mentioned in the public debate, in the academic debate regarding freedom of institutions. But in fact, issues that are frequently mentioned are patients' rights, public health, as I just mentioned. But what I want to show here is in fact that neutrality is in the background of both issues. Neutrality appears as a means by which the state has the duty to balance two rights and interests. On the one hand, freedom of conscience, freedom of healthcare institutions, on the other, public health and patients' rights. Of course, we must also consider the relationship between freedom of conscience of healthcare professionals and freedom of healthcare institutions. And on that point, things are more complex regarding the articulation, because the two freedoms might interfere between each other when the practitioner and the institution do not share the same ethics, or on the contrary, these two rights can complement each other when the institution and the practitioner do share the same ethics. A few conceptual remarks on neutrality. So first, you should remember that neutrality is a duty of the state. So the state has a duty of neutrality, but not society. So society is not or should not be neutral. Second conceptual remark, neutrality is not an objective as such for the state, but it is a necessary instrument to protect the freedom of conscience and belief of all citizens of different faiths and beliefs, and also a necessary instrument to protect the equal enjoyment of this freedom of conscience. And these remarks must be set against a trend that considers that state neutrality would require state-related institutions to refrain from operating on the basis of a particular ethos. So, because these trends consider that it would prevent individuals from enjoying certain rights. When I talk about state-related institutions, I mean private organizations that carry out a mission of public interest, of general interest, or organizations who receive public fundings, such as hospital, nursing homes, or other health or educational organizations. And this expansionist view of neutrality considered that such organizations should explicitly refer to neutrality as a sort of internal rule that would prevent institutions from acting according to a particular ethos, and that would prevent their employees from manifesting their religion or belief, or more fundamentally, that would prevent them from expressing a conscientious objection. And this expansionist view of neutrality actually leads us to a sort of vacuum neutrality, so neutralité par le vide. And my argument here is that this vacuum view on neutrality is not compatible with the idea of ideological pluralism, because neutrality should precisely contribute to pluralism. If we look at the case law of the European Court of Human Rights, we see that since the Kokinakis case in the 90s, the court insists on the fact that pluralism is inseparable from the effective enjoyment of freedom of belief in a democratic society. So the link between pluralism, freedom of conscience, and democracy. And this relationship is particularly effective in consociational democracies such as Belgium, so démocratie consociative, such as Belgium, such as Netherlands, such as in other states. So consociational democracies mean that their political system is based on a balance between multiple ideological pillars, société pilarisée. And in those countries, ethos-based organizations play a significant role in public service or general interest activities such as schools, universities, hospitals, nursing homes, etc. So here I will defend neutrality through pluralism in opposition to neutrality through vacuum. And with respect to healthcare institutions, pluralistic neutrality means institutional pluralism. So the key question now is, why would institutional pluralism or pluralistic state neutrality be more relevant than vacuum neutrality when we talk about ethical issues in healthcare? In other words, why would we consider that arguments in favor of pluralistic neutrality, in favor of institutional freedom in healthcare, are more relevant than arguments in vacuum neutrality against institutional freedom in healthcare? So here I will mention three main arguments in favor of pluralistic neutrality, and then I will respond to three counter-arguments to pluralistic neutrality, to institutional freedom in healthcare. So first, three arguments in favor of this conception. The first argument in favor of institutional pluralism is that when ethically controversial practices such as euthanasia, assisted reproductive technology, or abortion were legalized in several countries, this legal move was generally not politically absolutely consensual, as these practices were still considered by many people as not related to the conventional definition of medicine or healthcare. So the compromise that was found here was usually that no one, so no person, no healthcare professional, no institution would be forced to perform such controversial practices. So this was precisely the case in Belgium in 2002 in the euthanasia law. If we look at the debates at the time in the Belgian parliament, we see that there was an agreement between all members of the commission that no healthcare institution would be forced to practice euthanasia. And as I mentioned, there is now an amendment to the Belgian law on euthanasia that was voted in 2020, and which largely undermines this right. Because this amendment, under this amendment, no physician can be prevented by an institution from performing euthanasia. In this case, this amendment is currently challenged before the Belgian Constitutional Court. So that's the first argument in favor of pluralistic neutrality. The second argument is the collective dimension of the practices at stake, and therefore the need for a collective protection and not just an individual protection of conscience and belief. If we look at practices such as euthanasia or assisted reproductive technology in healthcare, we see that these practices inevitably require not only the act of a doctor, but also the participation of other healthcare professionals, in particular nurses or midwives in case of abortion. So not only the performance of the act can be collective, but also its impact on safeguarding the institution's ethos. If we take again the case of euthanasia, that is performed in a nursing home or in a nursing home where we have residents, volunteers, healthcare staff who all agree on another end-of-life approach, such as palliative care. In this context, performing euthanasia has consequences not only on the patient and his or her doctor, but also has consequences on the members of the institution's community who chose to live or to work in that institution because of its particular ethos or of his vision of healthcare. And the third argument in favor of pluralistic neutrality is in fact a counter-argument to vacuum neutrality, stating that vacuum neutrality is not as neutral as it might seem. If we look at the actual content of this vacuum neutrality, in fact, by imposing the possibility of ethically controversial practices within healthcare institutions, this vacuum neutrality implicitly or explicitly assumes that these practices are included in the usual definition of healthcare or medicine and cannot logically be excluded by healthcare institutions. And this position about the ethical status of such practices is an ideological statement and therefore contradicts the definition of neutrality, definition which requires the absence of bias on a particular issue. So this shows that vacuum neutrality tends to become an ideological objective as such and not an instrument in the service of freedom of conscience, not an instrument for the benefit of the fundamental rights of every citizen. So these are the three main arguments in favor of pluralistic neutrality, in favor of institutional pluralism. Let's now examine three counter-arguments that are regularly opposed to this idea of institutional pluralism. And for each of them, I will first introduce the counter-argument and then propose a response in defense of pluralistic neutrality. So the first counter-argument is that at the societal level, we need to ensure access to the practice in question. The idea here is that once the practice is legalized, the state must ensure access to it. And in that perspective, allowing institutions to refuse to provide access to this practice would jeopardize that access, because certain patients might have difficulty finding an institution where they could access this practice, especially in rural areas where healthcare facilities are more limited. And the response we could provide to this counter-argument is that it is indeed the responsibility of the state to ensure access to the practice it chose to legalize, despite its ethically controversial dimension. But precisely because of its controversial dimension, in the eyes of still many individual consciences, because of this, the responsibility for access to this practice cannot be transferred on the shoulders of each individual healthcare institution. So it is the duty of the state to organize its public health system in this perspective, but private health organizations cannot be blamed for refusing to organize this practice, which is not medical or healthcare in the eyes of their members. There's also, of course, the question of the lack of practitioners or institutions, as I mentioned, especially in rural areas. And this lack of practitioners or institutions willing to perform such acts should not be seen primarily as a threat to effective access to this practice, but rather as a signal that the legal regulation of this practice is not ethically appropriate in the eyes of many practitioners. So that's the first counter argument and what we could respond to it. The second counter argument that is opposed to institutional pluralism and to pluralistic neutrality is the patient's right to access the practice in question. So we move from a global or counter argument to a individual counter argument. And in this perspective, the institution would not be allowed to refuse certain practices as making these practices unavailable within its walls would go in contradiction with the right of their patients to access this practice. And it would be particularly the case if we consider that the patient in question is especially vulnerable, for example, a patient at the end of life. So this counter-argument, of course, raises an important issue, which is the need for the healthcare institution to make sure that exercising its institutional freedom does not have excessively negative consequences for the patients. And this balance between institutional freedom and the rights of the patient in general is threefold. So there are three elements we must take into account in this balance to be made. So first, the first element is the need for transparency. Transparency by the nursing home, by the hospital that hosts the patients, regarding its ethos and regarding its healthcare vision. So here what we need is a clear and sincere communication by the institution of its ethical orientation. And this transparency will enable the patient to make an informed choice about the institution. The second element that we have to take into account for this balance between freedom of institutions and the rights of the patient is the need to ensure the continuity of care for the patient, especially in situations where he or she asks, in situations where he's particularly vulnerable and where he asks for a practice that is contrary to the institution ethos. So especially in situation of vulnerability, but also in cases of emergency. And here again, this shows us the importance of transparency at an early stage, so importance of anticipation from the institution, but also from the patient. And the third remark regarding this second counter argument is that the balance between the rights of individual patients and the freedom of the healthcare institution must be properly understood. So this balance, on the one hand, we have the rights of the patients, which are certainly of importance, but there is not necessarily a right to obtain certain medical practices. So, for example, there is no right as such to euthanasia. And on the other hand, we do have a fundamental right of the healthcare institution to act according to its particular ethos. And finally, the third and last counter argument that is generally opposed to institutional pluralism is the freedom of conscience of the practitioner who works in the institution. For example, the practitioner who works under a work contract with the hospital or the practitioner who works at the request of his patient in a nursing home but without a work contract. And the idea here in this counter argument is that institutional freedom, which excludes certain types of practices, would prevent the doctor from freely exercising his freedom of conscience and his therapeutic freedom. And so again, here, such a situation shows us the importance of transparency, of anticipation by healthcare institutions towards not only the patient, but also towards the healthcare professionals they work with, especially at the recruitment stage. There is a need to explain to the candidate the ethos of the institution where he applies. But let's now take the situation where precisely there is a working relationship between the institution and the healthcare professionals, so especially in hospitals. In that case, we have EU law. We also have ECHR law, who recognize the concept of ethos-based organizations, as I mentioned, and this particular concept will allow healthcare institutions to have an additional protection of their ethos, and will allow these institutions to demand a higher degree of loyalty from the workers to the ethics of the organizations. Of course, there is a situation also of healthcare professionals who oppose the institutional ethos, but who do not have a working relationship with the institution. And in that case, it is of course more complicated, but it is important to recall that therapeutic freedom relates to therapeutic acts, and in this case, the therapeutic dimension, the link between the practice and the definition of medicine or healthcare is precisely disputed. So it puts into question the notion of therapeutic freedom. This brings me to my conclusion. Two open-ended remarks here. First, I would like to insist again on the need for a pluralistic view of state neutrality with respect to the freedom of healthcare institutions. Why so? Because, well, safeguarding institutional pluralism and freedom of conscience is particularly important in certain sectors such as healthcare or also education, because these areas include the performance of acts where conscience and ethics play a significant role. So we particularly need this pluralism in areas like healthcare. And the diversity of views of healthcare practitioners, of healthcare institutions regarding these ethically controversial practices, this diversity of views should correspond actually to the actual diversity of views of the population. So this must be seen as an argument in favor of diversity, of pluralism, the fact that in the population we still have this diversity of views, and so should we have this diversity in healthcare institutions. And my second concluding remark concerns the limits we already talked about, the limits of an exclusively individual and subjective view of fundamental rights. The issue of institutional pluralism shows us the importance of these intermediate structures, so structures between the state and the individual, structures that enable people to build personal relationships, that enable them to exercise at last their individual rights. And the position of a healthcare institution with respect to ethical issues does not only benefit to the institution itself, but it also benefits to all the people the institution brings together. So the healthcare professionals, the patient, the resident, their families as well, the administrative staff, the volunteers, etc. So safeguarding the ethics of these organizations contributes to democratic pluralism in the health sectors and democratic pluralism in society at large. Thank you very much for your attention.